Okay, I think we can go ahead and start. Good morning, good afternoon, and good evening, everyone. Thank you for joining us. My name is Amandine Berlert, and I'm the Assistant Director of Programs of the International Association of National Public Health Institutes, also known as IANPHI, and it is my pleasure to welcome all of you today. We are pleased to collaborate with the US CDC and the Johns Hopkins Bloomberg School of Public Health to host a series of webinars. The series addresses areas related to strategic planning, workforce strategy and development, partnership assessment and mapping, and change management. The objectives of the webinar series are for NPHIs to discuss their experience working in the domains, share best practices, discuss possible solutions to challenge faced, and touch upon the importance of NPHI to invest in these areas. We're excited to have you join us today for the fourth webinar of the series. Our panelists are coming from the Zambia National Public Health Institute, the Jordan Center for Disease Control, and the Department of International Health at Johns Hopkins Bloomberg School of Public Health. And they will discuss strategies for partnership mapping and stakeholder engagement in NPHIs. Now, a few housekeeping notes. The webinar is being recorded, and the recording and speaker slides will be made available on the IANPHI website later. Interpretation in French is available for this session. And if you would like to ask any questions, please use the Q&A box. And if you would like to share comments, ideas of resources that are related to the discussion, please use the chat function. Now, I would like to introduce today's moderator, Shelley Braden. Shelley is lead for the National Public Health Institute program in CDC's Division of Global Health Protection. She works closely with Ministry of Health officials to develop plans for addressing system improvements, and she coordinates with the internal and external partners to implement activities that strengthen NPHIs globally. Shelley is responsible for NPHI program investments in more than 30 countries in all regions of the world to help NPHIs use limited funds more efficiently, mount coordinated response to emergencies, generate and conduct research to inform policies and programs, and create a strong national voice for prioritizing public health issues. As a longtime collaborator and partner with IANPHI in supporting the building and strengthening of NPHIs around the world, it is my real pleasure to ask Shelley to share a few remarks about her role and the US CDC's investment in NPHIs, and to introduce our panelists today. Shelley.
Wonderful. Thanks so much, Amandine, and many thanks to everyone for joining today's webinar. This is the fourth in a series of webinars in partnership with IANPHI and Johns Hopkins University, and I'm really delighted that you have joined us. I'd like to briefly summarize CDC's work in strengthening national public health institutes, or NPHIs, and the partnership with Johns Hopkins University that has resulted in the module on partnership mapping and strategy development that we will hear about today. Since 2011, CDC's National Public Health Institute program has worked with more than 40 countries worldwide to establish and strengthen NPHIs. Our efforts aim to help better organize and coordinate public health expertise, scientific data, and public health systems. To support the growth and advancement of these institutes globally, CDC over the last several years has developed comprehensive tools to support NPHIs. These tools complement and enable NPHIs to move to higher maturity levels as established within the stage development tool. The SDT helps NPHIs assess current capacities, identify and prioritize gaps, and develop a roadmap for achieving a higher level of functionality. CDC also has the NPHI linkages framework, which supports NPHIs and other organizations to strengthen the interactions or the linkages among essential public health functions and the various organizations responsible for public health. Today, we are focused on the importance of partnerships and strategically engaging stakeholders for NPHIs, both crucial elements that enable NPHIs to better pool resources, expertise, and data to ensure a more coordinated and comprehensive public health response. By strategically engaging in partnership planning, NPHIs can better align resources and efforts with key stakeholders, optimize the impact of health interventions, and build a resilient framework for tackling emerging and persistent public health challenges. It is a real pleasure to be with you today. We all have presentations from 3 speakers, and then have a panel discussion and open for Q&A to have questions from the audience. As Amandine mentioned, please feel free to enter questions into the Q&A throughout the presentations. I'd like to first introduce our first speaker, Dr. Bhakti Hansoti. Dr. Hansoti is an associate professor in emergency medicine and international health at Johns Hopkins University. She is a clinician scientist focused on the implementation of evidence-based interventions in the fields of HIV, COVID, MPOX, and opiate use disorder to support vulnerable patients in the emergency department. She is the Associate Director for Academic Programs at the JHU Center for Global Health and Director for the Johns Hopkins Center for Global Emergency Care. Since March 2020, she has served as the Global Health Security Technical Director for the Reaching Impact, Saturation, and Epidemic Control, or RISE project at JPIGO. She oversees health system strengthening interventions across Afghanistan, Bangladesh, Ecuador, Guatemala, India, Ghana, Kenya, Lesotho, Mozambique, Rwanda, and Ethiopia, many countries. Her overarching goal is to increase the capacity of the global public health workforce to mitigate avoidable illness and injury from emerging threats. She is co-PI of a CDC-funded grant that applies to organizational management principles to national public health institutes in global health security priority countries to strengthen public health capacity for pandemic response. Recently, she was named the director of the Pan-American Health Organization, World Health Organization Collaborating Center for Emergency, Critical, and Operative, focused on strengthening the workforce capacity to mitigate avoidable injury and death. Bhakti, over to you.
You know, you always forget what you sent as the introduction. And as I was sitting here, I was thinking, how did I end up working with our CDC colleagues on partnerships? And the reason is this. Next slide. Partnerships are critical. Whether you're a clinician scientist, whether you're working in field epidemiology or policymaker, but without partnerships and effective partnerships at that, it's very difficult to make any gains. Dr. Juan Yuri from the World Bank goes one step further. Partnerships and collaboration are not only critical, they're especially critical with overlapping challenges and crises that impact women, children, adolescents. So that's why partnerships are important. Part of my work as a clinician scientist and now a technical director has required me to work with numerous ministries of health, public health agencies, and I would argue that this is one of the most important modules. And what was really challenging was thinking, well, how do we think about partnerships in a structured, systematic way? And that's what I'm going to present over the next 10 minutes here. Next slide. So a study from 2017, so a little bit outdated, sponsored by DFID, showed that there is a lot of partnerships here. And in this study, which looks at global health partnerships in particular, the investigators found that the number of actors is frequently more than 40 bilateral donors, 26 UN agencies, 20 global and regional funds, and over 90 global health initiatives. Now, that is at a global level. But what this really speaks to me is this isn't linear, it's an interconnected web of actors, donors, stakeholders. And each of them has perhaps a different lens, a different bias, a different raison d'etre for the work that they the work that they do and the policy that they shape. Next slide, please. So why is engagement important? Well, benefits of engagement are really clear, right? We need to have shared outcomes and goals. Engagement leads to trust and confidence. It leads to proactive planning and operations and collaborative thinking. But one of the challenges with not engaging your partners, it leads to a mismatch between values, goals, ideas, leads to uncertainty in terms of project outcomes, and it leads to reactive, not proactive operations. Siloed thinking is probably one of the biggest challenges we have in global health, especially due to the different lenses and biases and competing priorities that different stakeholders bring to the table. Next slide. So as part of our overall framework, which I think many in this audience have seen before, partnership was one of those core activities and modules that really is foundational, right? After the development of the strategic plan, partnerships is the next key strategy that relates to then workforce strengthening, your financial strategy, your strengthening of governance folder functions, and your strategic communications. So partnerships was pivotal, and we had the opportunity to work with NPHI on their partnership strategy, and you'll hear that talk from my colleague in a few minutes. So what was our approach? Next slide. We had 4 steps. The first was to identify who the stakeholders were. The second was to really define the linkages, right? But each of the partners, what is the linkage? Is it financial? Is it resource? Is it policy? And how much influence do they have, right? Who is shaping your likelihood of success in the strategic plan? And who is impacting your likelihood of failure? And then establishing goals for a thoughtful and cohesive engagement strategy. Next slide. So the tool that we used to identify stakeholders was NetMap. So NetMap is a web-based tool, but we used the principles of NetMap and did this paper-based. And the goal was to map the different partners and really just brain dump. And the reason for doing this is until we started talking as a group, we didn't realize how many actual partners were there. We couldn't actually put the ZNPHI NetMap here because there was too many partners to count. The reason for doing this was to understand like who are the partners that are impacting our success. And then the next stage was to categorize their influence. Next slide. So we thought about 4 types of linkages that a single partner may have, and a partner may have multiple linkages. They may provide funding, which is really clear, right? That funding could be just funds, or it could be infrastructure support or workforce support or seconded staff. They may provide information. The partner may be responsible for providing surveillance data that impacts your action plans. They may provide technical resources, either direct technical support or advisory support. And they may provide capacity. So this partner may be a true engagement partner where you would have a co-implementation plan, and your ability to execute your strategic plan depends on the capacity that this partner provides. Next slide. So after we defined the partners and the influence, we wanted to categorize this influence. We took the web of partners and we literally took Post-it notes and tried to say, what is quantify the influence and the investment? So the way we thought about investment was the ability of that partner to support NPHI financially or with other resources. So what is the likelihood that this partner's investment in NPHI will increase our likelihood of succeeding on our strategic plan? But we also wanted to categorize influence. So influence was thought of as, what is the ability of this partner to resist the NPHI strategy? And after we put all of these partners on a single sheet of paper, we then considered putting this into 4 quadrants. The top right is really key, right? Those are your key players. High influence, high investment. Those are individuals or partners where merely informing them is not adequate, but we have to have side-by-side strategic development activities. They're key to executing the strategic plan, but making sure that there is adequate and thoughtful engagement of those key players will decrease any risk in us succeeding. The bottom left is another key part, easy partner, right? These are low investment, low influence. They're your partners that you need to keep informed, you want to keep engaged, but it is okay if the action plan or the strategic plan doesn't completely align with the lens of these donors, partners, stakeholders. The orange and the yellow boxes were really the missed opportunities. So orange partners are great, right? They're high investment, but they're not going to micromanage. And it's important that we align our strategies to ensure that the work that we're doing can receive the resources that it needs. And the yellow box, the bottom right box, was the missed opportunity. We found that there wasn't as many partners in this bucket, but these partners had high influence, which meant collaboration and co-implementation with these partners would be really helpful to ensure success. Next slide. So this is from our NPHI work. And what we found is that low yellow box was where community-based organization, local governments, our local implementation partners, local NGOs often lived. And we found that there was a paucity of an engagement strategy for these partners in particular. The red and green boxes took up a lot of energy, but it was difficult to understand which partners we really needed to align with and which partners exerted a lot of opinion, but probably didn't have that much influence. And it was okay to take into consideration, but not ensure complete alignment. Next slide. So after this was done, right, we established like what the partnership gaps were, who the stakeholders were, how these stakeholders and their ideas aligned with the strategic plan. The next stage and the final stage was to establish our engagement goals. The International Association for Public Participation Framework provides 5 engagement approaches. The first is to inform. The second is to consult and obtain feedback. The third is to involve, really understand and consider the stakeholder goals and concerns. The fourth is to collaborate. This is joint implementation, participation in planning, design, action planning. And the last is to empower. So these are your partners where you have the ability to empower them to ensure that your strategic plan can disseminate and have further impact. And the key to executing each of these engagement strategies is communication. And that's why strategic partnership was a core module prior to strategic communication. Next slide. So the outcomes of this module, one, to use a tool like NetMap, not only to define who your partners are, but also the influence that they have. Use that to really categorize your partners and really think about grouping them so that you can customize your engagement strategies. Define your engagement goals and ideally align those with your strategic plan. And lastly, use this information to then create a partnership action plan. And my colleague, Mayoba Dindi, is going to be talking about how NPHI did this next. Next slide. This is just a reminder that when we did the strategic plan, we talked about communication, we thought through ideas for consultation, communication, how negotiation would be a part of the strategic plan, which partners were we willing to compromise with and which ones were we not, and which partners needed further relationship building and engagement. Next slide. So thank you so much for this time. This is a very brief overview of the module. And as mentioned previously, these slides are available to you, but so are these resources. And please do not hesitate to reach out to us.
Bhakti, thank you so much. Appreciate that outline and framing for us, and really thinking about partners and everything that partnerships can do to help advance an NPHI strategic plan, and the framing around what are the priorities for the NPHI and how that can align or does not align with potential partners in the public health system. Also about recognizing that time is limited and that the outputs from this effort can really help staff and leadership determine where to invest time and how to move forward together and in the most beneficial way. So thank you for that and look forward to the discussion. We'd like to move now to hearing from the ZNPHI experience and Mioba Dindi. Quick introduction. Mioba Dindi, he has a range of expertise in project management, planning, budgeting, partnership engagement and management, and monitoring and evaluation. He is presently the project director for Zambia's National Public Health Institute and Center for Disease Control and Prevention Cooperative Agreement. In his current role, he also coordinates partnerships. He has vast experience in working in the health sector, including as a planner with the Ministry of Health, both at the district and provincial levels, where he coordinated planning and partnership engagements through technical committee meetings and resource mobilization mechanisms. He has also worked as a senior monitoring and evaluation officer at the Ministry of Health, as well as an M&E specialist under the Africa Centers for Disease Control and Prevention Regional Investment Financing Project, which is a World Bank supported project at ZNPHI. Mioba Dindi has served as the first head M&E officer when ZNPHI was established, where he established the M&E cluster. Under his leadership, they were able to set up multiple systems for M&E, information management, planning and budgeting, and strategically mapped and identified partners that are critical to supporting the fulfillment of ZNPHI's mandate. Dindi, over to you.
Yeah, thank you so much. So we can move to the next slide so that I can get into the details. So basically, to introduce, ZNPHI is a specialized arm of government, which is responsible for coordinating public health security. So this mandate is, of course, fulfilled through surveillance, preparedness, and response to outbreaks, of course, anchored under strong laboratory systems and strategic information management. We can move to the next slide. In terms of the purpose of the ZNPHI being established, we definitely have a mandate, which is to and safeguard Zambia's public health security. I think I've already mentioned that this mandate is being fulfilled through surveillance and disease intelligence systems, through epidemic preparedness and response capabilities. We are also being able to fulfill this mandate by establishing public health laboratory system, anchoring it with a network of other clinical laboratory systems within the country. We also doing this by ensuring that we have robust information system and also capacity building through workforce development. In terms of our vision, ZNPHI is to be a center of excellence in public health security. And of course, our mission, as earlier mentioned, is to coordinate public health security. And in order for us to be able to coordinate public health security, which basically affects the entire nation when there's an outbreak, partnership engagement as well as mapping is quite important because of the complexities of outbreaks. So most of the times we need a lot of partners on board in order for us to be able to handle certain emergencies as they occur. We can move to the next. So basically, ZNPHI, when we did our second, or which was the first strategic plan under the, after ZNPHI was created as a statutory body, we identified 6 strategic pillars, which are meant to help the Institute fulfill its mandate. So we have surveillance and disease intelligence, epidemic preparedness and response, national public health, laboratory service, strategic planning and information management, field epidemiology, public health, policy, diplomacy, and communication. So these strategic pillars also serve as the anchor in terms of the partnerships that we have on board. So we find that most of the partners would align to set to in terms of their goals and outcomes. They would align to the pillar that is related to their functions and also what they intend to achieve in the public health security space. Then we have a 7th pillar, which is basically a support pillar, where we have HR, finance, procurement, leadership and governance, infrastructure and equipment. We can move to the next. So in terms of a historical background, for ZNPHI to be in existence today is because of a lot of partnership. Particularly, I would like to mention the US CDC, which played a critical role in the establishment of the Zambia National Public Health Institute, which of course was established due to the culmination of different events, starting from about 2010, when we had the cholera outbreak, typhoid, and also when we had the continental, an outbreak of Ebola on the continent, which led to the establishment of the Africa CDC through a resolution that was passed by the African Union. So in 2017, based on the recommendation of the African Union for each African country to have a specialized arm that would handle public health security, Zambia decided to establish the ZNPHI. In 2017, it was established as a department in the process of waiting for a legal framework to be created that would support its function. So as of 2020, we were able to have this act of parliament that enabled ZNPHI to become a statutory body within the Ministry of Health. So ZNPHI operates within the Ministry of Health, but has been given certain autonomy through the enactment of that act to spearhead and coordinate issues of public health surveillance. So in terms of the board, after the creation, we had a board appointed in 2022, then also in May of 2023, we did develop a strategic plan, and the same strategic plan was launched. So I think what is important to mention is that prior to the creation of ZNPHI, using a statutory act, we actually had our inception strategic plan from 2017 to 2022, which was more like a foundational strategic plan, which helped us to map different partners. So we already knew the kind of partners that were in the sector from 2017 up to 2022. Then in 2022, we had to amplify that based on the mandate that we're given. We can move to the next slide. So in terms of partnership mapping and stakeholders engagement processes and tools, I think earlier in the presentation, a lot of detail has been given in terms of the approaches that we did use in order to be able to map the partners. But I think it's worth mentioning that we developed the 2022 to 2026 strategic plan pursuant to the ZNPHI Act number 19 of 2020. And also based on the development of strategic plan, we had to map the different stakeholders that we have in the sector. That's public health security sector. So we had to map the bilateral partners, multilateral partners. We also had to map the line ministry partners, subnational partners, those that are key in the health sector and that are key for us to be able to coordinate the public health security. Then also in the process, we are using a balance scorecard as a tool for enhancing partnership coordination. So we can move to the next slide. So that's just an extract of our balance scorecard. And I think if you were to look at the lower, it should be on the lower left there, there is some of the key outputs of this balance scorecard. And one of them is stakeholder. And on top of that, we are talking of stakeholder engagement. And part of the indicators that we are tracking is to ensure that we are able to harness and ensure that we improve in terms of stakeholder engagement and continuously evaluate the kind of stakeholders that we have. We can move to the next slide, please. So in 2022, of course, we had support now coming on board somewhere in March, February. Johns Hopkins University, CDC, came on board to help us so that we could map the different stakeholders. As earlier highlighted, we had to map them based on the linkage, map them based on their influence, what is it that they are able to offer us. And we had a meeting which was a workshop, a partnership mapping and assessment workshop, which was held in 2023 January. So this meeting helped us to come up with a partnership strategic plan. So we're able to develop strategy on how we intend to manage the partners, because in the strategic plan, I think the details are not so much. So there were still some gaps, because using just the strategic plan as a tool to manage partners, that is not enough. So with the concept that Johns Hopkins and CDC brought on board, it really helped us to see the value and the need to continue strengthening partnership engagements and also mapping. We can move to the next slide. So in terms of what have we achieved? So in also to ensure that we don't lose the gains that we've made so far, we also had a senior advisor, partner and liaison coordinator appointed as part of the structure, because as an institute, we value partnership. So we have a position that is dedicated just to coordinate the different partners that we have. We also launched the partnership strategic plan on May 23rd of 2024. Then also we established a platform which allows us to engage with the different partners, which we are calling a partnership forum. So this focuses on different deliberate conversation around program implementation support from different stakeholders. We've also been able to hold partnership meetings with sub-national leaders. These are public health directors at provincial level, so that we are able to work in a coordinated manner. We can move to the next slide. In terms of the challenges, of course, I think when we started the process, our vision was to be having physical meetings in terms of the partnership forum, which of course is supposed to be held on a quarterly basis. But somehow that has been a challenge because of lack of resources to hold those physical meetings. So in order to strengthen that aspect, we have resolved that we are going to just be using virtual platforms, because virtual platforms will cut down on the cost. And if need be, we may be able to hold physical meetings once in a while. Then also the challenge is that after we established the partnership forum, we didn't go further to establish a point of contact database. Of course, we also need to have a detailed database based on the works that Johns Hopkins did, of course, help us to identify the partners based on the different linkages. So we are trying to work on a database where we shall be able to categorize these partners, of course, based on their linkages, what is it that they're able to offer, also based on their influence. So now work is going on. We have just distributed a tool just to be able to get information on the points of contact, and also to get the different partners that are linked to our strategic pillars. Then also, we also did, like I mentioned, we did develop and launch the strategic plan, but unfortunately, I think we didn't push further in terms of printing and make sure that this document exists both in hard and soft copy, and also to ensure that we are having regular reviews just to see how we are performing based on the outcomes that were set in the document. Next slide. I think this is my last slide. Thank you very much. I end there.
Wonderful. Dindi, thank you so much for that overview and sharing ZNPHI's story and work around partnerships with us. A couple things really stood out. Your emphasis on how the partnership plan was complementary to the strategic plan, recognizing the gaps and how a partnership plan could really move the strategic plan forward. Also, the development of a partnership forum. So a plan is in place, and then what structure needs to follow that plan to actually move it forward, and having that forum to have the targeted conversations with partners. And also the importance of provincial partners. So recognizing there are so many potential partners in the landscape of public health and within a country, but also those critical partners that are part of the public health system and necessary to move common goals together. So thank you so much. We will now move on to our third presentation from Dalia Zayed. She is an accomplished public health professional with over 13 years of experience. She holds a master's degree in public health and a bachelor's degree in human nutrition and dietetics from the University of Jordan. She currently serves as the Chief Health Policy Officer at the Jordan Center for Disease Control. Dalia has a robust background in health program management, health communication and promotion, research, and epidemiological surveillance. A notable achievement is her role in advancing the One Health approach to address complex health issues by integrating human, animal, and environmental health. In her current position, Dalia advocates for and implements evidence-based strategies and policies that promote health equity and improve health outcomes across communities. Her work includes refining national health strategies, conducting comprehensive reviews of existing policies, and collaborating with local and international stakeholders to advance public health initiatives. Her dedication to public health is reflected in her continuous efforts to develop innovative solutions to emerging health challenges, enhancing the public health landscape in Jordan. Dalia, over to you.
Thank you very much, Shelley, for the introduction, and it's a pleasure to be here with you all today. So I would like to start my presentation by saying that Jordan CDC deeply recognizes and values the critical roles our partners have, and that's why our slogan is Partnerships for Health Security. Next, please. So the birth of JCDC, Addressing Public Health Challenges. So during the COVID-19 pandemic, as we all know, it has exposed the fragility of global health systems, including Jordan's, and despite of the significant health expenditure. And this crisis highlighted the necessity for a dedicated national entity to coordinate efforts in preventing and managing epidemics and public health crises. And so in response, the Jordan Center for Disease Control was established in November 2020 to lead and coordinate national public health efforts as directed by a royal directive. Next, please. So as prescribed in our bylaw, Jordan CDC shall be a dedicated public health institute that promotes health practices in the prevention of epidemics and communicable diseases and lead the coordination of all hazard public health emergency preparedness and response efforts, including the bioterrorist threats. Next, please. Yeah. So this is an overview of our mandate, and I wanted to highlight here that we are mandated with coordinating the response efforts and implementing health emergency plans, as well as coordinating and cooperating with similar bodies regionally and internationally. We also are mandated with leading health efforts and monitoring epidemics and the capacity building and training and rehabilitation of public health professionals. Next, please. Jordan CDC is governed by a multi-sectoral board of directors chaired by the Prime Minister, and whose members include, in addition to the JCDC President, the Minister of Health, the Minister of Agriculture, the Minister of Water and Irrigation, the Minister of Environment, the Director General of the Royal Medical Services, and 4 experts a virologist, a bioinformatics scientist, a non-communicable disease specialist, and a legal expert. And this highlights the One Health approach Jordan CDC is trying to adopt in all its strategy. And our Jordan CDC president holds a ministerial rank and reports directly to the Prime Minister. And we are financially and administratively independent. Next, please. This is an overview of our organizational structure. So we have 6 technical directorates, the Emergency Preparedness and Response to Threats Directorate, the Technology Information System Directorate, Epidemiological Surveillance Directorate, Disease Prevention and Control, Laboratory, and last but not least, Research, Policies and Training Directorate. Next, please. When we developed our strategy for 2023-2025, we took a collaborative approach and we did this effort together with our key stakeholders nationally and internationally. So we focused on key public health domains through a One Health approach. We engaged stakeholders from government, private sector, academia, international partners to ensure comprehensive input. We utilized stakeholder mapping. So during our strategy development, we mapped all our stakeholders, we categorized them, and we did several in-person and virtual consultative meetings. And finally, we hosted a consensus building workshop to shape our strategy and to ensure that we have captured everybody's input. Next, please. So as everybody understands, there is always challenges, and we have encountered several challenges, and I would like to highlight the most important ones here. So it was the complex integration within the existing public health structure. So Jordan CDC being a newly established entity within a pre-established public health landscape, it was not easy to integrate our role, but we focused on, of course, complementing the roles of our partners. And the next challenge was the diverse objectives and how to align diverse objectives of different stakeholders within the limited resources, and maintaining continuous engagement amid the competing public health priorities. Next, please. Okay, so we conducted how we overcame these challenges and strategies. We conducted comprehensive mapping studies to assess the current public health infrastructure in Jordan. So in those mapping studies, what we did was at first we mapped all the stakeholders, and we did stakeholder analysis, and each study was followed by a consensus and validation workshop to agree on the main gaps and recommendations. And we also did multi-sectoral partnerships. So we established MOUs with national and international partners, including universities, research institutions, and public health institutions like the US CDC. We initiated a twinning program with the Public Health German Robert Koch Institute. We also activated our role in the existing national committees. We engaged regularly with partners through networks like today with IANPHI, AMR Multi-Stakeholder Partnership Platform, and the GORN. And we established specialized multi-sectoral committees. So we established the One Health Steering Committee, the Risk Communication Community Engagement Committee, AMR committees, National Laboratory Network, and National Research Committee. Next, please. Also, I want to share with you how building sustainable partnerships helped us in surveillance. So we established strategic partnerships and alliances, and we are currently actively developing a national integrated surveillance system aimed at unifying and streamlining data collection. We are also hosting the One Health Data Warehouse, which serves as a central hub for integrating human, animal, and environmental health data. And this supports a holistic approach to disease surveillance and response. Next, please. And I would like to share with you a real-life example that happened in 2022. So there was a heightened risk of cholera importation due to regional outbreaks here in Jordan. And the key actions that we're undertaking was that the emergency national coordination meetings and the engagement of various partners, including international partners, and the rapid response planning with a focus on travel, trade, and shared water resources. So the collaborative response framework was as follows. The Jordan CDC was responsible for coordinating multi-sectoral efforts and facilitated the implementation of national cholera preparedness and response plans. The Ministry of Health assumed leadership of health sector response. And the key factors for our success were the clear roles, pre-established relationships, and effective communication channels. And this helped us in the containment of the cholera spread, minimizing the public health threat, and enhancing regional security. Next, please. So the outcome of the engagement of our partnerships are improved stakeholder trust and collaboration, clear role definition and policy development, enhanced integration of surveillance system, and strengthened international collaboration. Thank you all, and I think I will end it here and leave room for the panel discussion and for questions. Thank you.
Wonderful. Dalia, thank you so much for that overview of Jordan CDC's partnership work. I found interesting the application and the steps that JCDC took to move the partnerships forward, including the very concrete development of MOUs, both with partners in Jordan and also external partners working in Jordan, and also this focus on integration into existing communities and looking at the landscape that existed in Jordan and where could JCDC support those existing committees, sharing information, partnership planning, but also the committees that would serve the public health system that JCDC was able to establish, and then call partners together to discuss those topics. You mentioned risk communication, community engagement, laboratory networks. So really seeing how JCDC could support the existing structure. We'll now move to a panel discussion and also answer questions from the audience. If you'd like to continue to post questions in the Q&A, we will address those. I'd like to begin with a question to the three panelists, and really thinking about the competing priorities. Everyone acknowledged this in the presentation. And what strategies do you use to ensure that stakeholder engagement, that it can remain a priority when there are competing demands and pressures in public health? So any thoughts there? Bhakti, please.
So I can start with this. I think that's why a communication strategy has to become an inherent part of your engagement strategy or your partnership plan. One thing that came across in our listening sessions that we had with stakeholders in Zambia was that partners felt that communication was sometimes spotty, again, when those competing priorities happen or when you're dealing with an outbreak. And so one thing that was established was these technical working groups. And no matter what was happening, those technical working groups may change their focus. They may go from future thinking to just-in-time information dissemination, but the technical working group's meeting schedule was maintained. And then there was a person that was assigned whose sole job was to maintain these communication mechanisms effectively, not only throughout outbreak, but also throughout planning. So partners felt like they were informed and involved.
Thank you. Dalia,
yeah, I can add about Jordan's experience. So we try to always maintain open communication with all our partners. And we do this in a collaborative approach. So we had an experience with hosting national committees, and we recognize that sometimes everybody's voice is important, equally important. So what we did is we adopted the co-chairing style. So where everybody felt equally heard and had the same influence. So this was a very successful strategy that we have dealt with. We also held regular meetings regardless of different priorities. So we have two different models. We have regular meetings and we always engage with our stakeholders, in addition to emergency meetings that are done amid changing priorities in the public health landscape. And as I previously mentioned, we also formalized our partnerships and communication through MOUs and formal communication channels like meetings with quarterly or regular committees with regular and quarterly meetings. Over to you.
Thank you. Appreciate that. Indeed.
Yeah, I can also add. I think in terms of what we are doing here, of course, we usually have platforms such as the incident management system, which allows partners to participate, and usually this is during an outbreak. But we also have the National Epidemic Committee meetings, which also provide a platform for continued partnership engagement. So these committees are held whether there's an outbreak or not. But also what we've done is that in a One Health approach, we still have a lot of technical working groups that are happening. For instance, we have the One Health itself, we have the AMR technical working group where different partners are part of these meetings. Then in recent terms, we are trying to develop a One Health system, which has brought about different partners from the various different players within the health sector. So the purpose of this system that we are developing will see us bring on board to a one integrated platform that will be data from AMR, animal health, environment health, and human health, plant health. So it's quite a robust system that cannot just be accomplished in isolation. So the thought around that is to have regular meetings. And what we've done is that for that platform itself, ZNPHI is not the chair. So we've picked a chair amongst the different partners to chair that meeting so that ZNPHI just takes the secretarial work. But also we have weekly meetings where partners have been given a leeway or authority to be part of those discussions around surveillance, epidemic preparedness. These meetings are held basically almost on a weekly basis, and partners do have access. But I think there's more that we need to do, and this is what we are trying to do by strengthening the partnership forums so that these meetings we've actually had talks with colleagues that maybe we can actually be meeting even on a monthly or a quarterly basis so that we are always engaging regardless of the outcome, whether we have an outbreak or not. We have to ensure that there's also this continued communication. And just in addition to what my colleague mentioned, and also the communication strategy is quite key, so that through that communication strategy, we are able to identify who's responsible for what, and through that communication strategy, it will be easy for these partnership meetings and strategies to continue regardless of who's in the office. I submit.
Right. Thank you. And hearing common themes about these standing meeting structures, standing committees that are meeting regardless of what is happening in the public health landscape in the country, and also shared leadership, whether that's as co-chairs of the committees or the example from Zambia, where they are secretariat and another partner is the chair of the committee. So really that sense of ownership among partners in the structures that have been put in place. Thinking about the impact and effectiveness of stakeholder engagement and partnership efforts, how do you evaluate that impact and effectiveness? And what role does data play in shaping and adjusting your stakeholder engagement and your partnership strategies? Dalia, Dundi, if you'd like to go first, please.
Yeah,
Okay.
thank you very much. Yeah, so I think data does play a very important role. As you have seen here in Zambia, what we are trying to do is also to make sure that this partnership engagement is equally part of our M&D frameworks, because at the end of the day, we want to evaluate the impacts of this partnership. For example, partners like here in Zambia, they've invested quite a lot of money, for example, CDC, in helping us develop systems that also are generating data. So at the end of the day, the effectiveness of this system, once we evaluate a system like the EIDSR, it also helps us to evaluate the effectiveness of this partnership that CDC is bringing on board. and also somehow also the data that we are generating, because we have partners that are also offering us not only technical support, but they are on the ground. For example, when we were at Corridor, we had partners that were on the ground from CDC, UNICEF. They were helping us on the ground. So whatever achievement we get to score at the end of the day is not an achievement that we can claim that we've accomplished it in isolation. There are different players that help us to combat an outbreak. So when we see data improving, when we see diseases reducing, the burden reducing, it's also an indicator that the resources that the partners are bringing on board, whether be it financial, technical support, we have partners that actually offer human resource, all that is contributing towards the mitigating these diseases. Currently, we have a threat of monkeypox. We are seeing a lot of partners coming on board. Some are offering monkeypox testing tools. Some are offering to support strengthening of data. So we see that if we work together with these partners and this data is being generated at the end of the day, and then the disease burden is reducing, it's a great indication that the work that partners are doing is contributing greatly. So just in concluding, the impact is easy to evaluate using the data that we are generating. For example, we had an increase of COVID, but when partners came on board, we saw a decline in the COVID. Same applies recently. We had a cholera outbreak just in January, and we had a lot of partners coming on board. Ministry of Health taking an upper hand, disaster management unit taking an upper hand. We had cooperative bilateral partners, multilateral partners bringing different support, some bringing chlorine, some bringing PPEs, some supporting us in the area of data. And at the end of the day, if we're able to evaluate, truly we can see that there's a great impact that we are getting from these partnerships. And also just to emphasize that this is where now we need to constantly review. For me, I think the partnership strategic plan should not just have strategies of how we are going to work together, but also stipulate some of the activities that partners will be critically involved in. It must also have an M&D component so that we're able to evaluate the impact of this partnership. So we need to strengthen the partnership strategic plan by ensuring that we bring on board an M&D framework, which will be a framework that will hold accountability all the partners that are on board. And through that shared framework, each partner would be able to know what is their contribution in terms of the outputs, the outcomes, and the broader impact, because this strategic plan should have a broader goal. For example, it must be a living document. So, for example, a strategic partnership plan should have a time frame. Say in the next 5 years, with these partners that we are working with, we want to achieve ABCD. And those goals that are set in the strategic plan must be able to be evaluated. They must be able to be, evaluated as well as reviewed on a regular basis, so that the different outputs and inputs from different partners are being taken care of using a result framework. And with that, it will be easy to achieve. Thank you very much.
Thank you. And India, I think the emphasis on data from different angles and how this is all coming together, both internally and with partners. Dalia, anything to add from the Jordan experience?
I just wanted to highlight that we evaluate the impact and effectiveness of our stakeholder engagement by focusing on tangible outcomes. So, for example, we look at how well the roles between Jordan CDC and the Ministry of Health complement each other, and how successfully we have implemented national health strategies in collaboration. So, of course, data plays a crucial role in shaping our and adjusting our engagement strategies. We gather feedback from stakeholders during workshops and meetings, and this allows us to make quick and informed adjustments to ensure that our strategies remain effective. Thank you.
Thank you. I have a couple more questions, but I'd like to turn to a question that was posed in the Q&A what advice would you give to ensure continuity in partner engagement following a leadership change? So please provide guidance for both the institution and the external partner, recognizing that we all work in organizations where the leaders change from time to time, and how does that impact your partner engagement? Dalia?
Yeah, so I can say something that was already mentioned, but this is of high value. So having those technical committees or working groups, this is very essential to sustaining health initiatives and to making them work. So we do have steering committees, and those are very important to endorse important decisions and to take forward initiatives. But not less important are those working groups. So we always make sure there are focal points and points of contact at the technical level where we always engage them and communicate with them and keep them up to date and informed with all our updated strategies and their expectations of their roles and our roles. And in this way, we kind of ensure continuous engagement regardless of leadership change. And documentation is not less important. So it's very important to document these processes and to have terms of reference for such working groups, and so that everybody has clarity on the roles they play and the tasks they are mandated with. Thank you. Over to you.
Thank you. So that structure remaining in place, even when leader change. Yes. Dr. Dindi, anything to add?
Yeah, so basically, I think just to add, she has mentioned most of the things. I think what really helps, we've had a situation of leadership change in Zambia, but I think the most important thing is that these partnership engagements, coordination, they are built on systems and not on individuals. So it's easy to be able to carry on and to proceed even in the event of change of leadership, and also having a system, documentation, knowing what partners we have. And every time there's a transition, effort has to be made so that the new leadership are kept up to breast and are able to meet the different partners that support the institute. That would be my contribution. Thank you.
Thank you. Dr.
I think the last thing here is documentation is really key. So, I think the MOUs that have been established or the terms of reference are really critical to ensuring that the ideas live beyond leadership change. And MOUs in terms of reference can be tweaked, but once that language is documented, it cements the collaboration and provides a reference tool to ensure continuity.
Thank you. Another question for the panel, and everyone touched on this. I'm curious how the challenges, there's always going to be challenges, right? And so thinking about the challenges and aligning the goals and objectives of diverse partners. So we've heard about the strategic plan for the NPHI being the driver. And how are these partnership plans and mapping aligning to support and advance that strategic plan? The reality is that all partners across government, those that are investing and partnering in a country, will also have goals and objectives and priorities. And so I'm wondering if you can speak a little bit to where that tension exists and how you're able to overcome that challenge when trying to align goals and objectives with a diverse set of partners. Dr. please.
So in the previous webinars that have happened, we had talked about public health function mapping. So really identifying what are the key functions that the NPHI is responsible for, and then who exerts power and influence on those functions being executed. And the second is strategic planning. So this is why these two tools are really key, because I think it is very muddy, right? And it also changes in times of preparedness, times of response, and it changes as the funding evolves as well. So I think it would go back to saying that this is where that sub work in the different technical working groups is key, and the function-specific thinking is critical, because one single strategy for the whole NPHI doesn't make sense. And what we found in ZNPHI was that different CDC groups worked with different members of our ZNPHI teams, and they had different relationships and different delineation of responsibilities. So dynamism is important, but going back to function mapping and thinking about the functions that you're responsible for really provides clarity and is a thoughtful tool to further decipher this.
Another question that we have from our participants. So in the event that a donor or partner pulls support, so funding levels are always changing for governments across the board. Specifically, if you were planning on funding from a donor partner that was part of the partnership discussion, and then that funding or support goes away, what structures, what's in place? What does an NPHI do when that happens? Curious to hear any thoughts from Dindi or Dalia from your experience there.
Yes, so I would like to highlight that here at Jordan CDC, we do not do service delivery. We rather do work at strategic and policy level. So if that happens, or if we had, a partner or a funder that suddenly pulled out, that's what we usually do is mitigate this risk to begin with. So what we do is we always try to institutionalize any activity. So when we ask for any proposal or concept note, we always try to see how sustainable this activity could be and how we can build it together with that fund. So we do not focus on one-time ad hoc activities or events. We rather focus on how we can build the capacity of our own staff and do like training of trainers or training of mentors and pooling here at JCDC and at different universities and academia, and enhancing the capacity of different local professionals to be able to move on with the activities on our own in the future. Over to you.
Thank you. Dindi, any thoughts from ZNPHI?
Yeah, thank you very much. Yeah, so usually such pulling out of partners, we of course experience that. But I think for us, what has been helpful is that most of the support that we've received has kind of like been tied to a project life cycle. So with that in mind, it's usually easy to plan based on the project life cycle. We know that, for example, maybe Resolve to Save Life, they say they'll support us for 2 years. So it's quite easy for us to see how we are able to utilize that support within that 2 years. But also in the event that the support is declining, what we have put in place are measures to be able to also bring the different partners in one room. For example, recently we had different partners in one room discussing financing, so that we're able to showcase or to be able to identify where most of these resources are being channeled to. And of course, based on those interventions, I think it helps us to be able to rechannel part of the resources that could be going towards a similar activity and yet another activity suffering. So I think bringing partners on board, discussing these issues, helps us to rechannel the finance, divert the finance, and be able to support those areas that may end up having a gap because a partner has pulled out. Thank you.
Thank you. And I think the two examples really demonstrate well-defined needs and being able to address what won't happen if funding stops, and also being able to prioritize that. I think we all work in environments where there's never enough funding. And so really that prioritization process is being very critical. We have time for one more question, and a question from our audience. Some examples, are there collaborations between NPHIs? So thinking about neighboring countries, the question is specific to those collaborations and partnerships between NPHIs in neighboring countries to stop spreading infectious diseases. So any specific examples from Jordan or Zambia there?
Yeah, I can share with you the same example I had about the cholera. So we, with the support of the WHO and other international entities here, we collaborated and communicated regularly with our peers or counterparts in the neighboring countries to discuss the point of entry measures and to make sure that we share our data. And this was very helpful in aligning our efforts and making sure we contain the spread. Over to you, Dindy.
Cindy?
Thank you very much. I think Zambia, of course, been hosting the Southern Africa Regional Collaboration Center, an arm of the African Union, which has about 10 countries been overseen by this Regional Collaboration Center. Zambia has played a critical role. For example, through our FETP programs, we've had fellows coming from neighboring countries such as Malawi being trained. So Zambia is helping to build capacity in other countries by training them through our FETP program. We've also supported when there's an outbreak, for example, in Malawi, cholera. Zambia has offered support, not only, and I think Zimbabwe, if I'm correct, but we've offered support, and we've equally also received support from our colleagues from neighboring countries. We've also had in-exchange visits, for example, because Zambia has, it's one of those countries in the southern region that has successfully established an NPHI. So we've had countries like Botswana, Malawi, coming to learn from Zambia how we've managed to be able to set up this NPHI. So in terms of collaboration, I think using regional bodies, for example, for us here in Africa, such as the Southern African Regional Collaboration Center, as a tool to strengthen coordination among the different NPHIs in the region. I submit.
Thank you. Dindy makes a really great point, acknowledging the expertise across NPHIs and how that expertise can be shared through these existing regional organizations, regional groups, regional exchanges, but also the importance of that direct peer-to-peer exchange. I think that is one great added value of what Africa CDC has put in place. Obviously, the IANPHI network and being able to reach out to various NPHIs, either neighboring countries or globally, to really learn from each other and the expertise that can be tapped into in these NPHIs globally. We are going to end there. Looking at the questions that have been received and sticking to time, I want to again thank our three panelists for presenting and being part of the discussion. Thank all of our participants who joined the webinar today. Both the slides and the recording will be available on IANPHI's website. So you will be able to access this after the fact and see the slides again. And again, many thanks to both IANPHI and Johns Hopkins for the work in putting this webinar together. So thank you, everyone. We will end there. Have a good day.
Thank you. Bye.
Thank you.
Thank you.
Mm-hmm.